Extra Foods, we care for you. That's why we always have the widest variety, the best prices, spacious aisles of total convenience, plus clean, safe surroundings. Let us care for you. Extra Foods, always extra for less.
Hello, Assalamu alaikum, and a very pleasant good evening to all our listeners and viewers. Welcome to tonight's episode of Doctor in the House, where we aim to educate, advocate, raise awareness for women's health issues to enable you to make more informed health decisions and seek more appropriate medical care. Tonight's episode is kindly sponsored by Sultan Drinks, and we have 4 flavors. They include lemon, cola, power, which I'm holding here, and iced tea. I am Dr. Amina Khan, specialist obstetrician and gynecologist. I'm a fellow of the Royal College of Obstetricians and Gynecologists, and I currently work in the private sector. I'm also currently an executive member of the Central Branch of Trinidad and Tobago Medical Association, where we teach, treat, mentor, and advocate. Every month, and September that went by recently, is dedicated to gynecological cancer awareness. However, every day and every month, it is important to remind, acknowledge, and support those who have experienced this disease. Unfortunately, the big C is something that is life-changing, often an incurable disease. It is a very sensitive topic. And our role is to guide you to be more cognizant of your body, be aware of the different types of gynecological cancers or precancers, the signs and the symptoms, the screening modalities available, and why it is important to understand that prevention is better than cure. Tonight, the focus will be on this important, relevant topic: women and gynecological cancer, prevention and awareness. So to assist me tonight, I have a very special, eminent, and experienced guest and colleague, Dr. Vanessa Harry. She is a gynecological oncologist. Good night.
Thank you very much,
And
Anna.
a very pleasant welcome, Vanessa.
Thank you for having me.
Sure, it's a pleasure. Can you tell us a little bit about yourself?
So, like you, I'm also a gynecologist and look after women's issues from period problems to things like fibroids, prolapse, but my main area of specialty is oncology. That's the field of cancer, and particularly gynecological cancers. So these include cancers of the uterus, cervix, and ovary. And just to demonstrate a bit, I mean, these are things sometimes, we take this for granted, but the womb, which is the uterus, is here. And of course, the womb is part of the female reproductive system, but lots of things can go wrong, particularly womb cancer, which is up in the lining. Just the neck of the womb or the mouth of the womb here is called the cervix. And that's a very important area because cervical cancer is the commonest gynecological cancer in Trinidad, right here. Ovaries right and left on both sides, fallopian tubes right and left. So as part of the female reproductive system, there are things we can do to prevent disease and pick up disease early. And this is the area that I do feel very strongly about, that women need to be aware of and really aware of any changes that could happen.
Great. So can you summarize again for us? There are different types of gynecological cancers. How many are there again? Can we outline?
So anything in the female reproductive tract can. So the main one that I think everybody should know, because it can be prevented, is cervical cancer, cancer of the cervix. And having said that, there's a very simple test available to us called a pap smear. They prevent cervical cancers. Uterine cancer, which is just pretty high up inside the lining of the womb, is the other type. Then you can have ovarian cancer. So those are the top three: cervical cancer, uterine cancer, and ovarian cancer. Those are the three that I see the most of. Others include vaginal, vulval, but they are more rare.
They're less common.
Not as common.
Sure, no problem. And there are risk factors for cancers. So if, for example, cervical cancer, ovarian cancer, and endometrial or womb cancer, can you describe some of the risk factors?
Yes, so starting with cervical cancer, that actually is the one I can prevent by doing pap smears. But some risk factors include smoking. So if anybody in Trinidad is still smoking, I would definitely advise them to stop. That's the main factor for cervical cancer. Other factors with cervical cancer tend to be related to HPV. HPV is a virus, human papillomavirus, that causes cervical cancer. HPV is entirely widespread. Almost the entire population, once you've reached a certain age, has been exposed to HPV. And there are risk factors that put you at risk of those. Sometimes it's the number of partners you have, the age that you started having sex. All these things increase the chance of you getting HPV. Having said that, even if you have HPV, it doesn't mean you're going to get cancer. And we can prevent that by doing HPV screening as well as pap smear. However, endometrial cancer, cancer in the uterus, this is in the lining of the womb. Pap smears cannot pick it up. These risk factors tend to be things that we really overlook. If you are overweight, that is the main one. Again, smoking, being diabetic, and having high blood pressure. Some of those risk factors are the same for ovarian cancer as well, but an important one is obviously family history.
Sure.
Having a relative with ovarian cancer, especially a first-degree relative, your mother, does put you at risk of this.
Great. And just again to outline, and this is something we need to emphasize to patients. A lot of patients do not understand the difference between screening for cervical cancer as opposed to endometrial or ovarian. And later on we'll discuss those in detail. But just to emphasize exactly as you said, for cervical cancer, prevention is via screening with pap smears. And it's available free of charge in all our local health centers. Women need to avail themselves of getting these done, and there's no need to fear. Because that's the other thing. A lot of women may think that a pap smear is very painful, but it is a relatively painless procedure, and it's a quick procedure done in the office setting, and it takes less than a minute.
Yes.
The difference too, as you said, there is a difference between cancer of the cervix or the mouth of the womb and cancer of the inside or the endometrium. And a lot of women think if you do a pap smear, it's detecting endometrial cancer.
Or everything.
Or everything.
Yes,
exactly.
I get that. I get that misconception a lot with women that I see, the patients I see. They come to me and they say, well, look, my pap smear is normal. Everything is fine. That really just means one area is normal, just the cervix. I have many women who have a very normal, healthy pap smear, but could have an endometrial cancer, could have ovarian cancer. So a pap smear test is one part of a gynecological checkup. You should have a gynae checkup once a year, where not only do you do the pap smear for cervical cancer, but you have an ultrasound. You have a visit with your own doctor who asks you about your periods. What about bleeding? Or if you've gone through menopause, do you have any post-menopausal spotting? That's bleeding that happens well after your periods have stopped. So that is a big misconception, I think, here in Trinidad. Pap smears are a very good test, but they are a very good test for only one thing, cervical cancer. It doesn't mean everything is normal. You do need a full checkup, just to have a handle on everything else as well.
Great. So again, that is where we emphasize your annual checkups are very important, ladies. even if you have no symptoms. So we advocate, again, you do not have to wait to have a symptom to come to your gynecologist to get a checkup. So are there different types of pap smears?
So yes, there is the conventional way that was done for many, many years, where a sample is taken from the cervix. The way we take a pap smear, however, is the same, and it's been the same for a very long time. Women do think about it as an invasive test. They think of it as an intimate examination. They might feel embarrassed, they might feel scared, but as you said before, the reality is it is a very simple, quick test that you shouldn't, be afraid of. Conventionally, it was done, a sample is removed from the cervix. There is nothing sharp, there are no needles. It's a test that literally can take less than 30 seconds to do, and then the cells are put on a little microscope slide and sent to a lab. There is another way where the cells are then put into a pot of fluid and sent to the lab, and that's called liquid-based cytology. That's the slightly newer way of doing pap smears. New, it's definitely been around more than 20 years now. Right. And does, however, make further testing easier. So the liquid one allows for testing for HPV, as I mentioned before, is a virus that can cause precancer and cervical cancer. They are both available. Definitely in the private sector, you have HPV testing, you have liquid-based. In some settings, there are only conventional smears available, but like I said, doing a pap smear is better than not doing any at all.
Yes, prevention is better than cure.
Yep.
So are there screening guidelines? So which woman should get a pap smear, and how often should she get a pap smear?
So ideally, you should start pap smears from age 20 to 25, and that can be done annually until you are 65 in some centers where HPV testing is available, and you have this co-testing where you do pap plus HPV, and if they are both completely normal, you don't need to do it every year, you just do it every 3 years. So in an ideal setting, you would have a pap smear and HPV test. If they're both normal, you come in every 3 years to do that again, but still come in annually for a gynecology checkup to look for other things, to look for ovarian cysts, check for fibroids, for someone to ask you, how are your periods, things like that. So I would say 20 to 65. That varies a lot in different centers, where they say, no, leave it for 5 years after the age of 60 or after the age of 50. And for women to stop screening at 65, you can really only stop if you've been completely up to date all along and all your smear test results have been normal. So if you come to do your first one at 60, we're not going to stop at 65. We will have to do it after. And I really hope the first pap smear is not at 60. It should really be in your 20s.
Right. This is so important because you and I both know we see so many women in our office setting, and a lot of them, you inquire, when last have you had a pap smear? And they look at you sometimes shocked, sometimes, what is a pap smear? I mean, in today's society, we need to be aware. We need women to be cognizant of the fact that it's so important, and don't delay. Yes, we women they get so preoccupied with their children, with having families, career life, but self-care is very, very important. So even a woman who, let's say she's been sexually active at the age of 20, she didn't do a pap smear, she's now 30, she is not sexually active. Should she get a pap smear?
She should, once she's been sexually active. Once she's been exposed, she can have HPV. So even if you didn't have any exposure after, you didn't have sex for, say, many, many years, you still need to do a pap smear. And I agree, women are not aware. They may have one in their life and, never have another one, because they don't realize the importance of doing them over and over again. The reality is, though, women in Trinidad, some will be aware and some will come regularly and do pap smears. The majority of women do not do them regularly. And unfortunately, cervical cancer, which is the one I can potentially prevent or is preventable by regular screening, is unfortunately the one I see the most of. And that is very disheartening.
Oh, yes.
It is distressing to see women with cervical cancer knowing that we could have prevented it years before. And a lot of people don't realize this, but cervical cancer is really not the cancer of the elderly. This is a cancer that women get in the prime of their lives, when they are in their 30s, 40s, when they are the backbone of their family. They will be a young mother, they have young children in primary school. This is when they may get cervical cancer. It may be at a stage where it cannot, it can't even be surgically treated. You have to have radiotherapy. So we want to prevent all that. And ideally, this cancer, no one should ever get cervical cancer now, because we have all the information, we have all the research, how to prevent, how to screen for it regularly. And the reality is, in some countries in the world, they very rarely see cervical cancers. We see it here every day. And that is, that does have to change. It's awareness, and of course being comfortable enough to do these tests with your doctor, because a pap smear is a very simple test. General practitioners do it, nurses in the health centers do it, specialists do it, so it is widely available.
Yes, very, very important, and that is the aim of what we want to emphasize to everyone. Okay, it's widely available. There's no need to fear it, and again, the importance of not just getting one pap smear, but keep being consistent and keeping up with doing them regularly enough. But also, in addition to that, is there something called HPV vaccination?
Yes.
And what is that?
Yes. So again, for research since the 1940s, it was discovered that this virus is the cause of the majority of cervical cancers. Well over 95% of cervical cancer is caused by HPV. This virus, knowing that it existed, allowed development of trials to develop what is literally an anti-cancer vaccine to prevent a cancer. And that was and still is a medical breakthrough, where young girls and boys should be vaccinated ideally before any exposure to the virus. By that I mean before any sexual activity. This vaccine is now on every child's immunization card from the Ministry of Health. It's under optional, so you have to opt to do it or not. It's not mandatory, but it's very safe, again widely available, free in the health centers, and now even being offered to Standard 5 students in primary school. And I would definitely suggest that, boys and girls and their parents, if they are aware of this, they should definitely be taking the vaccine. It prevents cancer later in life. Important for boys to have it, because then the girls are also protected via herd immunity.
Right. And that means that once the uptake is good enough over a certain percentage, it means that the general population is prevented. Yes? And the HPV virus, which is the cause of the majority of cases of cervical cancer, can also cause other types of cancers.
Yes.
So, we need to be aware of that as well.
True.
For example, cancers of the mouth, oral cancers, throat cancers, anal cancers as well. So, with the different types of activity, this is why it's very important. And, you emphasize that it's been around over 20 years. And the importance of it is that it's not promoting promiscuity, it's actually aiding in your health care and preventative care.
Yeah, that's true.
Yes, so that's what we need to emphasize as well.
Cervical cancer is a disease that should really be eradicated, and we now have a lot of measures to do that. Vaccination, screening via pap smear, screening via HPV testing, using liquid base. So there are countries that are aiming to totally eradicate cervical cancer, where they never see any more cases. It's hoped we can eventually reach that level. I think more women do need to come out, do pap smears regularly, and we need to vaccinate the young people for sure.
Sure, great. That's really important. Are there any signs that women should look out for? So, what are the warning signs?
So that's a really important thing, because what I should have mentioned is that you can actually have an early cervical cancer and not know it. So there may be no signs and no symptoms at all. Later on with this disease, you may get irregular bleeding in between the periods that you didn't expect, something totally unexpected in terms of bleeding after sex, things like that. But actually, if you had a very early cervical cancer, which can only be picked up on pap smears, no one can see it with the naked eye. If you had an examination, it's hard to see. If you have very early disease, you don't know you have it. There are no symptoms at all. So you could be walking around and not know you have it until it's much too late, until you have fairly advanced disease. Then you get the bleeding problems. Then you might get some pain in the tummy, pain in the back, difficulties passing urine, things like that. And that, for me, is a worst case scenario, because it should have been, not only prevented, but ideally picked up as early as possible. So no symptoms initially. Symptoms can develop later on as disease progresses.
Okay, great. And hence the reason, again, for us trying to detect before cancer develops.
Yes.
So that brings me to my next question. You can have a normal pap smear, and then you can have a pap smear that's abnormal or possibly cancer. But is there any change in between? Can we do anything about that at all?
Yes, I mean, we're really lucky that we know a lot about how cervical cancer develops, and this is the one cancer that literally does not develop overnight. It takes about 10 to 15 years to go from normal cervix to cancer. And these cells go from normal over time. They become pre-cancer, which doesn't even meet the criteria for cancer, but just mildly abnormal. Again, if left, they go from mildly abnormal changes to more of a higher grade abnormality. And then again, if not treated, eventually cervical cancer. So we have a lot in that in-between time to pick it up and treat it. This is really done with not just pap smear screening, but if you have an abnormal pap smear, I think it's important for women to realize if you get a report that says your pap smear is abnormal, it does not mean cancer, not necessarily. So you shouldn't really go into a panic. And there are different stages of abnormality or different phases. You can get a mildly abnormal pap smear, you can get a borderline one, you could get a slightly more abnormal, moderate changes, severe changes. None of this necessarily means cancer. It may mean you need a procedure called colposcopy, which is slightly more closer looking at the cervix using a microscope and just remove that offending area, all done in an office, done under local anesthetic, and therefore prevent you from getting cervical cancer later in life. And that is all standard ways of treating that is available just about in every hospital now.
Right, very good. So again, just to summarize, you can have a normal pap smear or you may have an abnormal,
Yes.
but abnormal does not mean cancer. And a lot of
Not at all,
times,
yes.
a lot of times when patients get called to discuss their results, so they get the phone call, alarm bells start,
Yes, that's true.
raising.
Yeah.
And, we also try to emphasize there can be even signs of HPV changes that can be picked up,
Yes.
and we can treat those.
Yes.
And even the pre-cancer changes that you mentioned, so the early pre-cancer abnormalities, which are the low-grade abnormal cells or the high-grade, those can be completely eradicated
Yep.
through the procedure of the colposcopy.
Yes.
And
Yes.
their treatment
Yes,
procedure.
and then stop that pathway from going from normal to cancer. We can easily stop that by treating the pre-cancer changes and removing it. So, which means it's usually a very small local anesthetic procedure. Having an abnormal pap smear, again, doesn't mean you have to have a hysterectomy. You don't need to take out the whole womb. That is a misconception, again, for pre-cancer. We could treat these via a much smaller procedure, which is really a day case procedure. You have it done and you go home right away.
Sure.
Yeah.
And that's very good to know. And follow up from that. So if you've had that procedure done,
Yes.
is it that's the end, the be on and
No,
end
again,
all?
you just need to follow up with pap smears a little bit more often, follow the instructions from your doctor, and they are normally following an internationally accepted protocol where if you've had some mild changes or even moderate to severe changes on the pap smear, then you follow up with pap smears in 6 months, then 6 months after that, until you are back on a normal regime. So that's standard everywhere in the world. It is definitely not a death sentence or anything like that. It's all it's all for prevention.
Okay, great. Very good. So it's time to take a small commercial break and we'll return right after.
The Baraka December Expo is back. Come on down to the Baraka grounds in central Trinidad from Friday the 19th of December to Wednesday the 24th of December. Get ready to shop and explore a wide range of wonderful vendors offering unique gift items at affordable prices with the widest variety of choices. So remember the dates, Friday the 19th of December to Wednesday the 24th of December. 6 days of fantastic shopping at the Baraka grounds in central Trinidad. It's the Baraka grounds December Expo. Don't miss it.
Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab an oasis, now why wait? Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab an oasis, now why wait? The greatest, the safest oasis for sure. Oasis, it's purer than pure.
Hi, good night, and welcome back again to Doctor in the House with me, Dr. Amina Khan, and my special guest, Dr. Vanessa Harry. Earlier on, we were talking about cervical cancer. Vanessa, can you summarize for us our little discussion that we've had so far, so for the benefit of all out there?
Sure. I think there are just a few important points that are the take-home message when it comes to cancer of the cervix. The first thing to say is this is one cancer we can actually prevent by doing regular pap smears. So it's not just one in your lifetime, it's at least every 3 years. And if you have any symptoms at all, that does not necessarily mean something is wrong. Your pap smear may be entirely normal. The second thing to say is that you could have an early cervical cancer and not even know it. So you could have no symptoms, no bleeding, no pain. So pap smears pick up changes even before you have a problem. So if you're sitting at home and thinking, well, my periods are fine, I've had no bleeding issues, I've had no pain, do I really need a pap smear? The answer is yes, of course you need a pap smear, especially if you haven't had one for the last few years. And finally, HPV vaccination is important. It prevents cervical cancer, good to give young boys and girls from standard 5 age onwards. And that really has been shown by good quality research and evidence to prevent this disease. Cervical cancer is common, but can actually be prevented.
Is cervical cancer in Trinidad on the rise, or is it on the decline? What has been happening?
Cervical cancer is currently one of the commonest gynecological cancers. I would say, yes, we see a lot of cases, at least 200 new cases a year. That's too many.
Wow, that's a lot.
It is.
That is too many.
And many of them are locally advanced disease with signs of spread already, which means it's been around for a while. I would not say it's on the decline, because we are not screening enough women. We need to be getting women out there to do pap smears more often, to start earlier, not to just stop after 1 or 2. Once we are pretty organized with women coming out and doing pap smears, then the numbers will start to go down. In addition to vaccination, will also help with the numbers of cases in the future.
So we, unfortunately, locally, we do not have a national screening program.
Yeah,
where both you and I have trained in England.
Yes.
We know that there is a national screening program, and that has enabled the incidence to really go on a decline.
Yes, of course.
So, I mean, we are trying our best. We are advocating as much as we can. We're trying to reach out to women, especially those in the rural areas, because those are the ones that may not necessarily have the finances to even come out, but but the local health centers
That's
are
true.
there,
Yeah,
and
it's true.
it is not a problem at all to register, go to your local
Yes.
health center, inquire about getting a pap smear done, ladies, and do not put it on the back burner, okay? So we've talked a lot about cervical cancer. But we also have to mention the other types of cancers. So let's talk a little bit about the symptoms of endometrial or
Yes.
uterine or
Yeah.
womb cancer.
Yeah.
Is there a difference?
So yes, cancer of the uterus is different from cancer of the cervix. They are two different diseases, picked up differently, present a bit differently, and actually treated differently. So even though we spoke quite a lot about pap smears, I think it's important for women to know that just having a normal pap smear does not mean you don't have another type of gynecological cancer. You could have an entirely normal pap smear, but still have a womb cancer. And that's really crucial because some of the signs of womb cancers are problems with bleeding, heavier periods than normal, more erratic, unpredictable periods all of a sudden. But the most important age group that has to think about uterine cancer is the age group after menopause. So once their periods have stopped for a year or more, you are menopausal. So no more periods, the hormones levels are down. But if you wake up one morning after not seeing any bleeding for years and years and you notice some spotting, it could literally just be one spot, doesn't have to be heavy flooding. That is abnormal. It's not supposed to happen at all. And you may then think, but no, I did my pap smear last year, everything is fine. But that is a totally different test for a different disease. So if you have bleeding after menopause, it could be a potential sign of a womb cancer. And therefore, that needs to be seen by a specialist who not only will ask about the bleeding, but ask about other risk factors, things like being diabetic, having high blood pressure. And if you are overweight, that's one of the main risk factors for getting a womb cancer. I see many ladies who are overweight and they're wondering how come they got this womb cancer. That is actually the main cause, the extra hormones produced by the fat stores.
Right.
And their complaint tends to be bleeding after menopause. I do have 1 or 2 patients who have womb cancers in their late 30s as well as 40s. And they complained about bleeding problems. Their periods changed, got heavier, more irregular. So it is actually common in Trinidad because we have a lot of diabetics here. We have people who have high blood pressure, so they fall into a high-risk category for womb cancer. This one cannot be picked up by pap smears, but it can be picked up very early by doing a sample of the lining. That could be done via a DNC, via a hysteroscopy, or it could be done by just a procedure in the office called a Pipel endometrial biopsy. You don't need to have an anesthetic just to pick it up. So it's something that can easily be picked up. And of course, the earlier we pick it up, the better the outcome is, the easier we can treat it, and better for all types of survival rates, things like that.
Okay, so you said quite a lot there.
Yes.
All very, very important information. And so, again, I agree with you. Endometrial cancer is primarily a cancer in women who are perimenopausal or postmenopausal. Unfortunately, though, as you have said, I have even also seen women in their 30s and 40s presenting to the office, and they have abnormal bleeding symptoms. And sometimes they dismiss it. Sometimes they think it's just a normal change. And that's where we need to emphasize that no matter what, you need to be assessed. It's better to rule it out than to leave it hanging and you're not aware of what is happening. And I also try to emphasize to patients, please do not follow a regimen or treatment that your friend or your family might be put on. So they may go to someone being prescribed some medication and you think that you can automatically use it. It's never, never the way to go. You have to be assessed properly, and we cannot give you advice over the phone. You need a physical examination, you need to come into the office, and you need to have your pelvic ultrasound done, a pelvic examination done, as well as the different procedures that you outlined. Any of those that can be done. So it depends, it's tailored to the individual based on her history. All right? And again, mentioning that, ladies, there are no periods after the menopause. So if you've reached menopause, and how do we define menopause? Menopause, once you are over the age of 45 and you miss a period for 12 consecutive months, you are in the menopause or post-menopause phase of your life. So any bleeding after that, as she said, it does not have to be a heavy period. It can be just spotting, but that needs evaluation. And again, we're emphasizing this, it does not mean you have cancer. There are other benign, meaning non-cancerous causes. However, we want to exclude it, and that's the only way to do it.
Yes,
so that's really good. And that's really important. What about ovarian cancer, however? So what is the difference with that?
So this is a different part of the female reproductive tract. These are the ovaries. We have two ovaries, right and left. Their function in life is really, they provide the eggs that eventually will be fertilized, you get pregnant. And the other function is they release the female hormones, estrogen and progesterone. So after menopause, that level goes down dramatically. That's why we get menopausal symptoms. So that's why the ovaries are there, for hormones as well as obviously fertility. Ovarian cancer, however, is a cancer that is everywhere in the world quite difficult to pick up because there are no real true signs or symptoms early on in the disease. And unfortunately, the majority of women may have very little symptoms at all. They may feel a little bit bloated, they may be feeling full after eating, changes in appetite. They can be very vague symptoms. They can be entirely misleading symptoms where you might think, oh, let me go see a bowel doctor or somebody in gastroenterology because I think it's an upset tummy, things like that. And eventually, months later, someone thinks, oh, let's check the ovaries, let's do an ultrasound. So it's not a disease that we pick up routinely very early, unfortunately. There are very vague symptoms, from bloating to changes in appetite to your clothes feeling a bit tighter to sometimes no symptoms at all. And it can be treated. Obviously, it's a combination of surgery to remove the ovaries, including the womb, as well as the majority of ladies with ovarian cancer will need some form of chemotherapy. The picture overall can sometimes be a little bit more dismal if we get it in the more advanced later stages, so we do try to pick it up as early as possible. But difficult to do because there is no screening test that exists that will pick up ovarian cancer before it happens. That is hard to do. A lot of women come to me and ask me, Dr. Harry, I've heard about a test called CA125. That is a blood test. I do it as part of my medical. Does that mean I'm not going to get ovarian cancer? Does that mean I'm okay? That test is not a screening test. It doesn't work like how a pap smear works. It actually is used in a totally different setting where we're trying to differentiate a cyst from being cancer or benign. So if you are just going along your normal daily life as part of a checkup and you do a CA125 and it turns out to be normal, it doesn't mean it's going to be normal in a few months, or it doesn't mean you cannot get something wrong with the ovary in a few months. And in fact, just doing it is thought to be worse because it lulls you into a false sense of security that I'm fine. So if you get a few symptoms, you actually don't have it checked out because you think you're okay because this blood test, this tumor marker was normal. So I would really, I think, encourage everyone to ask your doctor, about all the tests you do as a medical. Are they really useful for preventing cancer? Most of them are not. Most of them are good just for your general health. You're looking at your kidneys or your cholesterol or your liver function. That's good for your general health, but they mean very little from a cancer prevention point of view. The things to prevent cancer include pap smears, mammograms, colonoscopies, things like that.
Right,
a CA125 is not one of these tests. Ovarian cancer is definitely a disease that unfortunately can literally develop overnight in some women.
Okay, great. So that's important to know. So again, we just want to emphasize that. But is there any way that we can reduce our risk of getting cancer?
I mean, overall, gynae cancers, you have to focus on weight, a healthy weight. I mean, everybody talks about diet and exercise as obviously much easier said than done. Screening helps with cervical cancer for pap smears. Smoking is a definite no-no because the studies are unequivocal in showing smoking increases cancer risk by far. What can you do to put yourself in a lower risk bracket? That is something that everyone, oncologist asks. However, other than diet, exercise, I think the annual checkup is good for keeping an eye on things. It doesn't necessarily mean you will never get something, but the earlier you pick it up, the better. Another really important factor is knowing about your family history, because if you have a relative with ovarian cancer, also with breast cancer, your risk is slightly more than the average population. So it is worthwhile talking to your doctor about, do I need genetic testing, things like that. All these things will put you in a higher risk category.
Right, sure. And just looking at you, you seem to be following that advice very well, because you're maintaining.
Not all the time.
You're maintaining your weight. We're both getting older,
yes,
so it's so important for us. And I think we ourselves try. Yeah. Right, but we ourselves try to live a lifestyle, follow our, dietary advice, exercise. Everyone has stress. We all have to deal with stress, but lifestyle changes are paramount. Obesity, unfortunately, chronic non-communicable disease is on the rise. So even through the Ministry of Health, they are trying to emphasize and increase our awareness of diabetes, chronic diseases. So by making this impact, we hope that it will reach the population. And it doesn't start when you reach your 30s. It actually starts even prior to pregnancy. That's true. So even before, we are obstetricians as well, so we know that we emphasize so much on starting from the fetal stage, meaning pregnant mothers, before they conceive, maintain your health. You don't get pregnant and have gestational diabetes, which then can predispose you and your unborn fetus to chronic life disorders. Things like even polycystic ovary syndrome. It is on the rise. That puts you at a risk of getting ovarian cancer, endometrial cancer as well. The use of the birth control pill, is there any, can you just give us a little bit about advice on that? Like some women worry about ovarian cancer and the pill?
Yes.
Is that correct?
The oral contraceptive pill has been around for years and years. There are very good studies now showing that the pill is protective of ovarian cancer, actually. So that is a well-known misconception that the pill causes cancer. It doesn't, or it wouldn't be so widely available and widely used. The pill is actually very safe for a certain part of the population that have no known medical issues, no heart disease, no history of clots, migraines, things like that. They, are not overweight. They will be an ideal candidate for the contraceptive pill. And no, it does not cause cancer.
Great, great. Can you tell us a little bit about BRCA gene testing, or what is BRCA mutation?
So a BRCA mutation, I think people are aware of it now, in that it's a genetic mutation that you inherit, and it does put you at significant risk of not just breast cancer, but ovarian cancer. I think it really came to light because when celebrities highlight some of these things, people do learn about it. And that sometimes does much more than you and I talking about it, because Angelina Jolie is BRCA positive, and her mother and some other relatives had breast and ovarian cancer. I think her mother died, actually. And she was found to be BRCA positive, and really raised awareness for this topic to the point where you could aim to prevent this disease in yourself by prophylactically or preventatively removing the breasts as well as the ovaries, because your odds of getting the disease are more likely if you are BRCA positive, and very, very likely. But this genetic mutation is something that can only be determined by testing. And who should get tested? It's determined by your family history. So if you have a number of relatives, particularly first and second degree relatives with breast and ovarian cancer, you should speak to the specialist about doing genetic testing, and it is available here. So if you are found to be BRCA positive, then we can advise you what to do to prevent getting breast as well as ovarian cancer. And it's really important to know for your children, for other members of the family as well.
Sure. So we are not Angelina Jolie,
Yes.
but we are definitely still advocating.
Yes.
And I think a lot of women will hopefully be able to, this is bringing awareness, and
Yes.
a lot of them will be able to make those decisions appropriately. So what is your take-home message for all our beautiful ladies out there?
It's really tricky, I think, for women because, at home, you put yourself last. As a wife, a mother, or you're working, even a young lady, you're really, it's important for you to progress in your career. You think of yourself last. But I would advise all women out there to, for at least, a short time, once for the year, put yourself first and have your regular checkups. That will include an annual pap smear, once you're 40 and over, annual mammogram and breast ultrasound, and see a gynecologist just to check things like look out for fibroids, for PCOS, for polyps. The reality is the majority of women will not have a gynecological cancer.
Right.
But we want to pick up the ones who do, and we want to pick them up early so we can offer a good cure, offer a good quality of life. And a checkup, even if it's just a pap smear, literally takes just minutes to do, but it gives us so much benefit and really improves outcome. I think my final piece of advice is, monitoring things like your weight, being active, diet and lifestyle is important in preventing cancer, but hard to avoid things like processed foods, which we all eat, but just to monitor those things.
Of course, of course. Very, very good advice, Vanessa. I would like to say that this basically concludes our exciting episode tonight. Any queries or comments can please be forwarded to the telephone number 788-6249, or gynae, you can email to gynaeadvice@gmail.com. Also, you can send your queries or comments to the number 399-4189 or gynecologytt@gmail.com. I'd like to thank God for this opportunity tonight. Thank my good colleague Vanessa for attending and sharing your insight with us tonight and your expert knowledge. I'd like to thank IBN Studios and our very dedicated camera crew. Please join us in December, inshallah, where we will be discussing another exciting topic on gynecology as well, on the topic of endometriosis. Take care. Good night, everyone.
Thanks for having me.